Hello, I'm Dr. Blanton, a specialist in plastic surgery, and I'm here to chat with you about one of the common topics that we hear about with body contouring, and that's the bra roll procedure. So, in general, why do people choose body contouring? It's for several reasons. Some is related to just loose hanging skin after some weight loss, or if people end up having just rashes that are in certain areas where things are rubbing against clothing, some difficulty moving, and sometimes with just having clothes fit the right way. So basically, when you're choosing body contouring, you have to decide that you're wanting to end up trading shape for scars. So the results when you end up having some of the skin excise are going to be dependent on what the skin tone of the patient is like, what the integrity of kind of the support system or the fascia layer, and also the distribution of where the fat actually is. So the bra roll is kind of a common thing that people are either disgusted with or just annoyed with because the excess skin is sometimes just hard to end up hiding. You can wear conforming garments, you can do different type of bra shapes or no bra at all, but it really is kind of a challenging thing. And depending on kind of how much skin and how much fat people end up having, you can use kind of multiple ways of taking care of this. You can kind of do the old-fashioned weight loss, like more weight loss, and sometimes the fat distribution will end up decreasing enough that it may not end up bothering you, but quite honestly, that's not most of the patients that I end up seeing. Usually patients will want to end up having some sort of procedure done, and that's related to either liposuction if it's a decent amount of fat with good skin tone, or you need to have an excision of the area, or even a combination of liposuction and excision of the area. So again, you have to kind of trade a better shape for scars. So the bra roll excision itself is kind of daunting when you think about it, but when you excise all this amount of skin, it's going to leave an incision that is going to be hidden within the bra roll itself. And so when you end up looking at this photo, it seems like there's a lot of excess skin removed, and depending on how much extra skin you have, sometimes there's a small amount, sometimes there's a larger amount that's removed. But basically you're going to end up having an incision that's kind of hidden within the bra line. So for a patient that ends up having just a small amount of excess fat and skin in the upper area of the bra roll, liposuction only was kind of helpful for her, and she ended up having a reasonable result from just the liposuction alone. When you have somebody that has a lot of extra skin and extra fat, doing the bra roll excision ends up creating incisions that are right near where the scar line and bra line is going to end up being. And in some patients, you get extra skin that's both in the front and in the back. And in this patient, she actually ended up electing to have a reduction mastopexy. And so this is her before, and this is her after. And you kind of see this on the lateral view where you end up seeing a lot more extra skin and fat on the side. And then after the reduction, you can end up taking that out. And then at a stage procedure, having the extra fat and skin that she had before taken out at a second procedure, again along where the bra line is. So it all depends on kind of what your body shape is going to end up being, on whether you need something staged like that or if you need liposuction or just the back excision only. But in general, I would say this is not a super invasive surgery from a recovery standpoint. Most people need about a week off from work because you do have a drain that's placed and you have to wear some compression garments. But once the drain's out, you'll be able to get back to work and you can wear the compression garment for that month. And from a pain perspective, it's not that painful of a procedure. It's usually a few days of kind of heavy medication, narcotics, but then changing over to Advil and Tylenol pretty quickly. The results usually, you're going to see them instantaneously, but it usually will take a good 3 months before you're going to end up having the final results just due to soft tissue swelling. And then you can end up seeing things based on your before and afters, just like you saw here. And we'll do a nice montage of where your before photos are going to be shown, and then your after photos, and you'll get to see the improvement. So thank you very much.